Hi, this is part two of our class on technology and heart. And last week, I got a little bit carried away with more of a history than you'd care to know. Okay, but this time, hopefully, we'll talk more about the technology part of it. Okay, I think I need to be able to advance my slides. I'm going to pause the recording for a second. Okay, so we'll talk more about technological advances, especially in the last 75 to 80 years. Obviously, I haven't practiced for 75 years, but have practiced for almost half the time of that year. Now, just to put things in proper perspective, in 1950, when I was born, life expectancy in the United States was 62 years. In India, it was, believe it or not, after the fall of after the Brits left, it was 32 years. And penicillin was in short supply, was restricted primarily for military use. There were tuberculosis sanatorium hospital all in all major cities, and there was no organ transplant, no bypass surgery, and there was no measles vaccine and no flu vaccine. Okay, so the life was pretty short. Okay, and heart disease was increasing, and we'll talk about it as to why that happened in the Western developed societies. And by the way, I think there was no polio vaccine also. And you may recognize this middle person who was one of the most famous polio victim. Okay, or polio, yes.
Talk to Marvin Friday, the guy will check on it if he can't figure it out.
Okay, so he was there, and there's a lot of you are too young to recognize these three people, but these are the three big, great leaders of the great power at the end of the Second World War, who was starting from left to right: Winston Churchill, Joseph Stalin, and Franklin Delano Roosevelt. And he was the most polio victim, and they successfully were able to hide that he was in wheelchair. Okay, now the reason for talking about him, because it's not a vaccine class, but it's when he was at the famous conference to decide the fate of the liberated Europe, his blood pressure was markedly elevated. Let me just things put on pause a little bit. So that was the state of the art of the treatment. And that time, the treatment was quite unsatisfactory for that time. And based on the further chemical development from sulfonamide, which were the original antimicrobial drugs, diuretics were synthesized, and that was the start of the antihypertensive treatment. So the two major problems, obviously myocardial infarction, valvular heart disease, and hypertension. So the treatment for any of them was quite dismal, to put it mildly. Okay, and now this obviously when the president has hypertension and heart disease is increasing dramatically in the Western society, the government gets into the act, and Congress passed the Heart Act, which was signed by President Truman, and that led to a National Heart Institute pour tons of money, and that was the start of the first population-based trial for heart disease in a small town called Framingham in Massachusetts. And it started out looking for risk factors for heart disease, and that was the association of cholesterol. And this was also known by studies that was done during to feed the soldiers by epidemiologist or zoologist actually named Ansel. He did what is known as a 7-country studies and established that cholesterol and high-fat diet was associated with heart attacks. And he was famous to do what is known as K rations for the army. Now, moving on to the Framingham study that has been going on for not just for a few years, but for 3 generations. Okay. And there were like 5,000 people, and their grandchildren have been followed. Initially, risk factors were assessed, their blood tests, and height and weight and obesity and incidence of heart disease and strokes and so on and so forth. Now it has expanded to include varieties of things, including biomarkers and epigenetics and genomic studies, and extending into Alzheimer's studies as well. So it has generated tons of papers from the study, and every physician would have had some knowledge of it. Okay. And on the tails of this, the chemist and physiologist did. By this time, adrenaline was already known from 1930s. So the chemists got to work and came up with small molecules. And this was done by the famous industrial chemical giant called ICI Corporation in UK. And they discovered a beta blockers, means blocks the adrenaline of the beta receptors inside your heart and vascular tissue. And so this was the first groundbreaking treatment for hypertension. Now, just goes to show that to do research, you don't always have to be at university. He was one of the first person who was working for chemical corporation, and it came up and synthesized varieties of important life-saving medications, including Tagamet for ulcer disease and beta blockers, which changed the treatment altogether or hypertension. And he was, so after 30 years with the usual delays, he received Nobel Prize. His name was Dr. James Black, just for the historical purposes. Now, technologies, as I mentioned last week, uh, wars have a good way of advancing medical sciences, and based on sonar technology, a property of certain crystals called piezoelectric uh, elements, which would include certain ceramics and zirconium, which based on sound wave changes their shape. It's, I guess, almost like your old-fashioned record player type of thing, and it generates electricity. So this was used, and the name is of Greek origin. You can see it, press and squeeze, and uh, and this was amplified and was used to record sound waves, from heart chambers, because the blood flow and the walls have a different density. And the two Swiss scientists, I'm sorry, yeah, no, I'm sorry, Swiss Scandinavian scientists discovered the principle of ultrasonography. Okay, and this is what the standard modern echo ultrasound. Now, for some weird reason in abdomen, which does not jump up and down with every heartbeat, it's called ultrasound. In cardiology, it's called echocardiogram, because you're receiving the echo, and cardio means heart. And this is the standard echocardiogram. There is a small window outside, because the biggest thing is air is a poor medium for reflecting sound waves. Okay, the sound travels obviously faster through liquid, that is blood, and a heart wall. But someone has to find what is known as a window, and this is the standard echocardiographic machines. And varieties of advances have taken place, starting with the static, like in the so-called ice peak view of the ultrasound. At the same time, then the window was expanded like a fan shape. That was the two-dimensional image, and now we even have a three-dimensional image. I'll show some of them, just for a demonstration. And, and with a further advance in engineering and material sciences and chips, the machines have been reduced in size. And now you can see that a doctor does not need to have a stethoscope hanging around his neck. He can walk in the ER with a portable ultrasound machine and can diagnose uh, cardiac pathology much more accurately, and just at the bedside. And this devices are quite affordable, and most of the major emergency rooms have access to this. And the training curve is not that difficult. Okay, and let me show you a demonstration. Hopefully this will play. This is the ultrasound. You can see the ultrasound beams come from the top. Patient is lying flat. The feet are on this side, the head is on this side. And as the heart moves, this is the so-called left-sided valve. And I think I can't slow it. And let me just go back a little bit. Nope, I don't think, So, and this is sliced along the short axis, so heart looks like a bishop's mitre. And this is from the apex looking towards the right shoulder. You can see the four chambers and the valves moving in synchrony. It's rotated 90 degrees, so it's called two-chamber view. Okay, and the blood casts, a shadow. And then based on that, the Japanese were quite advanced, and based on the flow pattern, the flow was given a Doppler flow was given a direction, and when the flow comes towards you, it is red. When it goes away, it's called blue. So based on that, we're able to make certain basic geometric calculations. Okay, so that's is ultrasound technology has progressed dramatically and has become a big tool and armamentarium of the physician. And this is the standard high school physics of Doppler waves, and which we are all familiar with. And the Doppler effect is based on the frequency and wavelength. And so that's all well known to you. So I don't think I will elaborate too much on it. The sound intensity increases as it comes towards you and decreases when it goes away. Okay. Now, so these are some of the advances that have taken place. A three-dimensional echocardiogram, which is, looks at all three up, down, and uh, anterior, posterior, front, back imaging. Uh, and now with the association of time, we can say it is a four-dimensional image. We can inject various radio opaque materials, so given contrast. And then we can also determine the actual uh, tissue density based on how much fractional shortening of the myocardial of the muscle takes place, and various complex mathematical calculations can, with the change in the pattern, is called speckle tracing. It almost looks like a star wave pattern, based on sound wave frequencies. So there are some various, but now this is obviously there are huge learning curves with measurement technology. And the biggest problem with ultrasound is called signal to noise ratio. Okay, and the size of the patient makes a huge difference as well, called signal to noise ratio. Okay, now, in spite of all the technological advances that the engineers and sound engineers have devised, it's sometimes impossible to get a good window. So we can't look from the front, so get behind the heart, so to speak, to get just like getting behind the Niagara Falls. So now the way to get behind the heart is to miniaturize the transducer element and insert it via the food pipe. So the food pipe, you can see from this picture, it is right behind in the esophagus. Now this is a blind probe, and once you turn on the sound beam, you get a picture like as if you are turning into a midget and looking at the heart. It's called trans means across esophageal echocardiogram, and you can diagnose pathology on the back side of the heart because the heart is not exactly straight up inside; it is tilted, with the apex pointing towards the chest wall, and the back part is lying towards the back. Okay, and it's more leaning towards the left side. So the anatomy has a way of making things a bit difficult for imaging. But this is one of the ways of getting around, and you get some rather dramatic views. Okay, now this is not the ice. This is not the ice that is in the news, but it's called intracardiac echocardiography. Okay, let's see how this plays.
Acunav Lumos is used to aid imaging during the treatment of atrial fibrillation, the most common form of arrhythmia via concomitant pulse field ablation, PFA, and left atrial appendage closure, LAAC. Using 4D ICE for procedural imaging uniquely reduces personnel and time compared to a typical TEE, optimizing efficiency. Guided by ultrasound, two venous sheaths are used to gain vein access at the groin. The 4D ICE catheter is manually threaded through the sheath and maneuvered up the vein into the right atrium of the heart. Acunav Lumos provides live enhanced 2D image quality. Directed by biplane imaging, a transseptal wire is precisely guided through the intraatrial septum into the left atrium. The transseptal sheath dilates the opening, allowing 4D ICE catheter access. 4D ICE continues to provide live imaging of left atrial anatomy. Before ablation, 3D calipers are used to accurately measure the anatomy of the ostium and left atrial appendage, thereby reducing planning and aiding in procedure therapy guidance. PFA is a non-thermal ablation procedure for short bursts of high energy achieve pulmonary vein isolation. To conduct PFA, 4D ICE follows the ablation catheter, no matter the configuration, as it is positioned at the ostium of the pulmonary vein, and a pulse field ablation is performed. 4D ICE is used to confirm contact with all four pulmonary veins.
Okay, now this is probably
Post-ablation
lot more complicated than you'd want to know, but that just shows that when your blood clots occur, there is a little pouch behind one of the left-sided chambers of the heart. That's where the blood clot forms, and like a garbage inside your sink, and that's the one that causes. So people get what is called an umbrella type device that is inserted coming from the venous side and plugged in, and that it sounds weird and sounds rather crude, but it does work and prevents the need for blood thinners for lifelong and reduces the incidence of stroke. Moving on to the next device, which was came in the late 50s and early 60s, and which was called the pacemakers. And this was thought about, back even in the 19th century, but that was too primitive. And in 1930s, various surgeons in the United States and Russia experimented with stimulating the heart electrically, because as we know, bioelectricity research and EKGs have been around for quite some time. So, but this was limited by the power source. And as you can see from this little historical picture, that the pacemaker was, the poor man had to cart it in front of him. And this was, the external surface pacemakers. Those were the early days started, but now this was on the tail of the Manhattan Project, and there was enthusiasm even for nuclear powered. Imagine walking around with a tiny radioactive source inside your heart. That never caught on, but with the availability of lithium batteries, those other things kind of fell by the wayside. Okay, I'm sorry, that is a typo. It should be 1956, not. Okay, now this is a very interesting human interest story that one of the earliest heart surgeons in Minneapolis was frustrated while that the child's, he was a pediatric heart surgeon, and the heart would slow down and stop because they're working close to the wiring of the heart when they're working on the heart valves. And so he asked one of the friendly neighborhood electronics wizard and technician, not as to, can you do something about it? And luckily from him, he had read Popular Science, which had an article about transistors. So he was able to jerry rig a transistor, put it inside a container, okay, like a battery, a cigarette pack size, and wired it with a piano metronome, and says, "Yeah, doctor, this is something." Now, at that time, there was no human experimentation committee, and he did not have to go through any peer committee review. And next time when the heart stopped of a child of the next patient, he just hooked it up, and by goodness, it worked. Okay, so that was the start of, and the technician went on to find a very well-known company called Medtronic. Okay, it was founded by the electrical engineer. So it just goes how innovativeness and has a dramatic impact on health and human happiness. Okay, and this is, a rather busy slide, shows the evaluation of pacemakers. You can see the early pacemaker, there were huge box like a mini transistor radios, and then there were first implants that were done, and in Sweden and in the United States, and then it was introduced intravenously, basically because you don't have to stick needle inside the heart, and then not just the bottom chamber, because if you pace just the bottom chamber, the impulse is going backwards, and that is not physiological and causes reduced output. Again, basic fluid mechanics. So there were both chambers were placed in synchrony, okay, and then again, not just the right side of the heart, but the both sides were placed with synchronizely. So again, just like but imitating nature as much as you can. The lace and now these are again tangled wires that has its own complication. That when you put wires and pockets, there is chances of infection that is much more common. So now the technology has been miniaturized to the point of something called a leadless pacemakers have been introduced. So this is a miniaturization to the max. Okay, and I'm sorry, I think I had a picture. Oh yeah, here's the picture for it. Okay, let's see here. So this is just shows how small it is. It's almost the size of a small AAA battery. Okay, and this is again, this is the retrieval feature while the whole pacemaker is inserted. You can just say it's just like a hook, so to speak. And this is the battery and the electronics. And I'm just amazed with the miniaturization that is done and the pacing electrodes that are there, the ventricular and atrial. So you can just see as to how this just stays inside the heart and avoids. Because I remember from the early days when pacemaker had to be introduced, people, in order to avoid displacement, while scar tissue forms at the tip of the lid, patients had to lie flat in bed for like 48 hours, and that's no picnic for anybody. Okay. Now, the next important point that is of human interest story is a physician named Bernie Lown, who decided to do something about the sudden death, which is due to ventricular fibrillation. And he discovered alternating current with charging from a bank of capacitors, which can deliver voltage to the heart. Okay, which is, it's measured in joules, as you very well know. Okay, and it produces a sine wave and depolarizes the entire heart. And luckily, just like switching off the power switch, heart starts again by itself. Okay, and again, this was helped by his family members and a friendly engineer named Berkowitz. So and at the same time, depending upon where the stimulus is inserted, it can work for various other arrhythmias as well. And then further sophistication of the waveform and reducing the amount of energy that is needed. Now, this was done originally by Russians, but unfortunately, during the Cold War, Russian literature was not that well accepted or available as well. Okay, and now Dr. Bernie Lowen later on was a front leader in Physicians Against Nuclear War. Okay, and he and his team were recipients of Nobel Prize for big population-based groundswell effort that was undertaken. Okay. Now, again, we talked about the heart valvular disease occurs due to rheumatic fever and birth defect. And these were the prosthetic valves, that this is, you can just see, it's a silastic ball type plastic material that the ball goes up and down with the flow, and it has a cloth ring that is sewn. And now this was the earliest valve that were used in Portland, Oregon, at the university by surgeons. Now, the problem was that this ball, when it up and down, it worked like a hammer on-site for tiny red blood cells and cause a breakdown of the blood, causing further problems. So later on, some smart people came up with this type of ring valves. That's a disc that, based on the flow, it tilts back and forth, so-called tilting disc valves. And again, just like sometimes even the best engineering minds may not have entire success. And these valves, because of the continuous pressure of flow and the metal fatigue, you were prone to the develop of fractures. And that was a nerve-wracking event for patients, for physicians like myself who are following them. And so this has to do with this followed in the tail of the material sciences, very stylistic material, but that is combination of words of silicon and plastic. And this again was done, a lot of work was done by Dow Chemicals. And at the same time, they had to make sure that the nickel or metal, you have to use inert metal that does not cause immune reaction or tissue things. And the varieties of engineering prospects come into the thing, not just cavitation of the flow, durability of the valve, and the fluid mechanics all factors had to be considered. So it requires some very sophisticated engineering. Okay, so sorry, I think I was sharing the wrong screen. Okay, I'll continue with this now. Okay, and so that was the problems with the heart valves. Okay, moving right on. Then again, the metal valves require a blood thinner, which was not a picnic, because if it is too thin, it can cause problem. On the other hand, if it's not thin enough, then it cause problem as well. Okay, so the French decided to use something called pig valves or porcine valves, and the other alternatives were made from human tissue of pericardium, which is the sac outside the heart. And these were, dehydrated, and the circulation was denatured, so to speak, and the valve tissue was sewn on side the metal mesh stent, and it can form like a nice leaflet. You can see how it's a marvel of design, mimicking nature. Okay, so this tissue rings were sewn initially from pig valves, and later the size was not good enough, so it was from cows and horses. Okay, but this avoided the need for uh, blood thinners. But again, the longevity of these valves was not as good as one would like, because if it is, they didn't last, and they form scar tissue, and sometimes required second operation. So this was, so none of the measures were as good as what Mother Nature supplied. Now, we still had the huge problem with heart attacks or myocardial infarction, and that the heart is supplied by tiny arteries, which are few millimeters. And there was no easy magic technique, but sometimes serendipitously an accident comes to the way. And when a heart doctor was doing measurements inside the heart of a patient, and accidentally the tube fell inside the tiny coronary arteries, which I'll show a little later on, and he ended up injecting dye. And fortunately, the patient's heart did not stop. He asked him to give a solid cough, and the heart did not go out of rhythm, and was able to. So that was the first uh, accidental proof that one could inject dye, a small amount of dye inside tiny coronaries, and can take pictures. And that was the start of the. And then that took off with the engineering, with the more sophisticated catheters. Now, the biggest advance that took place in cardiology has to be seen from 1964, based on the data from Framingham studies and from earlier observation as far back as 1952 from UK. It took almost 12 years for the governments to be convinced against the tobacco companies for the Surgeon General to issue recommendations. Now, you may not recognize this old advertisement for a Chesterfield type cigarette, and this is done by a man who went on to become president of from the Republican side, named Ronald Reagan. He won election twice, and you can see how in the early days he was promoting cigarettes. Okay, so this was the biggest advance that has taken place. If you don't remember anything, that is the biggest step that you can take. Now, the heart disease discovery has to do with the gross pathology based on autopsies. And as far back in the 19th century, the German pathologists, were doing autopsies and were saying that there was fat deposits and plaques that were forming inside the heart. That was a possible cause of the heart attack. And then at that time, the description of heart attack was given by the various British clinicians, and then and sometimes the pathologists had also seen that on top of the cholesterol and cheesy plaque that takes place inside the heart. Now let's study this a little bit more carefully. This is the normal lumen, as you can see, and how a plaque forms due to cholesterol and fat tissue reaction. Okay, that takes place. This has been demonstrated in soldiers who died during a war in the 20s. So fatty streak develops at a rather young age. It takes several decades to enlarge, and with stress and further narrowing and reduced flow, the viscosity of the blood changes in the plaque can rupture and can cause heart attack. And sometimes you can just see that there is an endothelial reaction takes place and it heals by itself. Okay, and then sometimes it can bleed inside. Okay, and it can develop calcification, and it can be, you can see when the lumen narrows it completely, and that can be lead to heart attack. So these are the variety. This process takes as much as 30 years. Okay, now unfortunately, medicine is not a precise science, and it can go one step forward, one step backward, because at this time, not all pathologists were able to demonstrate that there was a blood clot that was taking place. So it took about 50 years to come to the understanding of the real pathophysiology of this disease. Okay, as to whether it was the plaque and the cholesterol that was the culprit for heart attack, or it was the blood clot. Okay, so that just went on for a long time, because people were not brave enough to inject dye inside in an acute heart attack when the patient is in throes of severe chest pain. Now, at the same time, the biochemists were helping us out, and two scientists, biochemists working in Houston, had done studies on liver cell and had demonstrated something called cholesterol receptors, okay, which were, uh, pointed the biochemical effect in, especially in people who have genetic abnormalities, something called familial hypercholesterolemia, where even a child who is 5 years old can have cholesterol as high as 300, normal being up to below 200, and or even 500. And I'll have a picture for demonstrated from. So they have a deficiency in their LDL receptors. When you eat fat, the liver has something called LDL receptors, and they manage to uh, uh, pick up the cholesterol crystals that are in your blood and lipid molecules, and degrade them inside the liver tissue. As I mentioned the first day, liver can be very forgiving and can see the LDL receptors binds the LDL and turns into, due to complex metabolic sequence, turns it to amino acids. And so the number of receptors have a lot to do with, so this was discovered by the Goldstein and Brown. Again, this was groundbreaking discovery that advanced the human health, and these mutations were discovered, and so this was a groundbreaking discovery. Now, once the receptors found, the chemists were right on the tail as to see whether can we block those receptors or improve their sequencing. Now, Japanese scientists who are working on antibiotics, okay, Akiro Endo, and they were discovered that a fungus that they were working with, had a cholesterol lowering property. But the Japanese company, was not too interested in that, so they sold the right to an American company. And the next thing you know, that this was groundbreaking in terms of lowering cholesterol. And the Merck chemical company modified the molecule slightly, and then there was the groundbreaking treatment called statin drugs, which lowers the cholesterol and reduces the underlying disease process instead of just creating new bypasses. Now, at the same time, an equally important fungal discovery, which is of dramatic, that people were looking for various antibiotics, and in 1964, an expedition was sent to Easter Island in the Pacific, in South Pacific, for search of various fungi in the soils, and a fungus was discovered which did I'm sorry, a mold was discovered which worked against, common thrush fungus, but at the same time it caused immune reaction, and so it was abandoned as antifungal or antimicrobial agent. But fortunately, a pharmacologist, an Indian guy named Sahgal, who was working with it, and he said, "Well, I'm not going to throw away the culture." He saved this culture, and when the advent of heart transplant, decided that this suppressed the immunity and was dramatically useful, and that opened up the floodgates for uh, anti-rejection therapy and made the job of the heart transplant surgeon dramatic. Now, this drug has been extensively investigated, and even inside your cell has been discovered called the mammalian target of rapamycin pathway. So there is an actual intracellular pathway as to how that came about, and evolved. That is your guess is as good as mine. Now, this particular medicine called rapamycin is also being used or tested for longevity. And it's also being used for varieties of other hematological abnormalities called thalassemia, where the hemoglobin is abnormal. So it has turned out to be a gold mine for disease, and it's a very interesting molecule. That was now the reason why it is called rapamycin, because the native name for Easter Island is called Rapa Nui. So that's how the discovery came about. So, okay, and I promised you earlier that I'll show you the picture of familial hyperlipidemia, and as you can see, this a little child has homozygous, means has deficiency of LDL metabolism, inborn error of metabolism. And these are the cholesterol plaques, which are not just inside her body, but they're, bulging her through her skin. And so obviously, and these children, then, without appropriate treatment, they will not live beyond 20 years. Okay, and now the treatment with the statin drugs, there are half a dozen of them on the US market, but at the same time, I think if you are big television watchers, you may see advertisement for monoclonal antibody type of drugs, which is available as well. Now it turns out that there are varieties of enzymes inside the liver which have to do with downgrading the receptors, and the monoclonal antibody blocker drugs has been developed. This works on I'm not even going to give you the name for it, so just say this is an enzyme inside the hepatic cells. So this antibody works on it, and so the receptors become more prolific and are able to reduce cholesterol dramatically. So this has prevents degradation of the LDL receptors, and thus dramatically lowers the cholesterol. So this has been a ground, and this has also been, even this is the first genetically approved drug, has also been marketed for this familial hyperlipidemia. And now these are quite expensive, but there have been a dramatic finding in treatment of coronary artery disease. Okay, and now we went through back and forth, because initially science sometimes forms hypotheses based on the available knowledge. And as I mentioned earlier, based on the Framingham studies and population studies in epidemiology, we just thought it was fairly straightforward. Cholesterol is the cause of the culprit. So lower the cholesterol, dramatically we should save. So the advice that was given was to lower the cholesterol. It made the cover of the Time magazine as well. But the human biology is a lot more complicated, and we fail to realize as to the other factors that are involved in it, such as inflammation, insulin, and stress, pollution, all the other things which were involved in causing the development of atherosclerotic disease process. So it's a chronic disease process, and one factor was not enough. It is a multifactorial disease. And again, so that it changed the requirement. It took about 20, 30 years for the idea that cholesterol was the only culprit fell by the wayside. And then, so later on, now finally, we are getting to instead of treating just a number based on a simple blood test, we're looking at the whole picture of, insulin resistance in the body, obesity, cigarette smoker, inflammation, okay, even stress. Okay, and not now that does not mean, I don't want to create the confusion that cholesterol is the only culprit and we have thrown that away. This is just, it's a lot more complicated than what we thought out to be. Okay, so this was the cover of Time magazine. This is not sometime in 75. This is 1999. So the government has revised the guideline, as to what is, so a small amount of cholesterol is safe, but beyond that, you could still get in trouble. And the treatment is much more individualized based on your risk factor profile. Okay, and the hypothesis that was initially suggested in 68, formed in 77, and it took us a long time based on correlating other things. So now, okay, and so this is a complex process which involves in the cell wall, cholesterol metabolism, immune reaction, and chronic inflammation, which are the various inflammatory factors called interleukin. Okay, and the disease process is finally understood in a lot more scientific basis, starting from inflammation, to rupture to the blood clot or heart attack. Okay, and it just shows us the 1950s were not good old days. You can just see, and now this is almost makes you cringe when you see these commercials. A baby to be given 7 Up. Kids need energy, so give them candy, and this takes the cake. More doctors smoke Camel cigarettes than anything else. And not to be outdone, the popular culture finally caught on with this thing as to the secret killer, inflammation. And when we find this thing, we try to discover varieties of other modes of intervening with it. And the next one was the role of the vagus nerve, which I mentioned last time, that extends from your cervical, from your inside the brain to where the nuclei are, to all the way to your stomach and intestine. So it's an immune moderator and has a huge, remember I mentioned in the very first, second or third slide as to it's not fight and flight, but rest and digest response. So that the vagus nerve stimulation has been, now this can be done with meditation and yoga or Tai Chi, but we want to do better life with electricity. So companies have developed what is known as a vagus nerve stimulator. And so this is the biological response that we are trying to find chemical and electrical solution. And so it occurs, all over the body, including not just heart, but pancreas, liver, kidneys, lungs, brain, you name it. Okay. And so that is, a dramatic way of, trying to mimic nature. And this again, rather busy slides, tells you the inflammatory process is various. So we can work on different targets, including the blood vessel, the cells inside the body, in the fatty tissue, and now there is a different concept called the inflammasome. Okay, so these are the varieties of drugs that work with the immune response. These are some of the monoclonal antibodies which are being used. And there are various and this has been useful in discovering various biomarkers that you may work in your, that incorporates chemistry and biology very nicely. And I think you may have some of the lab work assigned to you for this. Okay, and the C-reactive protein, that is one of the biomarkers that is coming into the vogue, along with other small molecules that are being used to classify patients much more effectively. And last but not the least, the diabetes and the weight loss drug. The Ozempic-like drugs have been shown to be beneficial for reducing heart disease. Okay, they not only just reduce weight and improve blood sugar control. It has been shown with large multi-center studies about benefit in reducing the insulin resistance, increasing the insulin sensitivity, and working on risk factors for heart disease, and in turn reducing the incidence of what is known as first event or coronary events. So it gives varieties of benefits have been well proven by various studies. Okay. And again, that, but there are some side effects, it's not exactly, and there is a thrust now to market it over the counter, but that may not turn out to be as safe as one hopes. Okay, I'll keep our fingers crossed. Okay, and now I mentioned earlier, but my slides are a bit out of sequence, but there are varieties of beneficial effects of activating vagus nerve. Cuts down the adrenaline response. Okay, cuts down the inflammation. Okay, apoptotic means the cells have a habit of killing themselves. Apoptosis means they self-destruct, so to speak. Okay, but so the vagus has a benefit of effect. And nitrous oxide is one of the molecules which relaxes the blood vessels. Okay, so that again, so these are all the negative things that are benefited by stimulating the vagus. Okay, and even in the heart, there are benefits of, increasing the mitochondrial function, forming new blood vessels. Okay, slowing down the heart rate a bit. Okay, so it has a much more calming effect. So the vagus nerve is literally everywhere. Okay, and this is, I'm not a surgeon, but this was the way that came around in 1967, putting in, just a plain simple mechanical approach, creating new channels. Now, obviously, the arteries that supply blood vessels are thick-walled, called arteries. Okay, and surgeons, since Mother Nature does not give us enough arteries, surgeons use something called saphenous veins that take the veins from the leg and use that as a new conduit. And this is varieties of technology that followed in the tail of advances in heart-lung machine, keeping the heart cool, and improving surgical skills. Okay, so that was a common operation, but again, it did not provide long-term effect because the underlying pathology continued, and so you do require medical treatment as well for cholesterol, anti-platelet drugs, and at the same time, lifestyle changes. Okay, but that's still, it's a very easy, effective way of reducing chest pain and prolonging life. Now, this was, the groundbreaking discovery. This is one of the few physicians who made on the cover of Time magazine was a prima donna South African surgeon who did the heart transplant after learning in the United States. and and now again, he was somewhat limited by anti-rejection because the rapamycin hadn't caught on to the mainstream. But again, his patients lived for about I should say 6 or 8 months, very and with complication, albeit. But again, this was the first attempt for transplanting of a brain dead person who was actually an African descent, and it was used in a white person. Obviously, South Africa at that time was in the midst of apartheid, and so this was a big controversial step at that time. And then he never followed up with too much with his success, and the American surgeons continued with this thing. Now, the varieties of other treatment where became available. This was an old movie, and on the case, one can say not Ghostbuster, but Clotbuster. As I mentioned, blood clot or thrombosis is the event that triggers the final closure of the blood vessel, causing heart attack. So dissolving the clot was in varieties of enzymes which are generated by bacteria called streptokinase were used, and later on a genetic company called, which I'll talk about in just a second, called Genentech. Okay, this was again a big advance in genetic. Okay, two geneticists got together with working with plasmids and restriction enzymes, and were able to, have bacteria uh, produce the medications and modify the genetic molecule. And the first, their big hit was insulin, and followed by something called a tissue plasminogen activator. That was the medication that helped dissolve this blood clot. The coagulation cycle has many steps, and on which this medication was devised, and it dramatically altered the prognosis and treatment of heart disease, because by dissolving the clot, we were able to buy time and to take care of the blockage later on with bypass grafting. So time is of essence, when the heart cells are dying every minute. Okay, so the clot dissolving medication was the first big step in the 1980s, which I witnessed during our practice. And we literally rushed in to infuse this clot dissolving medicine, and which was discovered by Genentech. Okay, and it's still widely used. Now the trend has changed that instead of dissolving the blood clot, if you have a procedure available, then one goes directly to inserting a little coil. Again, in a basic engineering task, if there is blockage, you insert tiny catheter, blow up with a balloon. You can just see how the balloon is expanded, and it's just like pushing the snow along the side on the sidewalk with a snow shovel. Okay, so it looks crude, but it does work. And then following that, sometimes the vessel walls did not stay up. So some expert Swiss cardiologists discovered something called a coil, which is, you can just see this is a little mesh that is inserted, and it's called stent. I don't know why it's called stent. That's beyond me. You can just easily use the word coil, and you can see how that. Let me see if I can show it to you a little bit better. Oh, sorry. Yeah, here we can just see this is, compromised artery, and the catheter comes inside, the wire is inserted, over which the balloon is advanced, and the coil is inserted called stent. Okay, so these are some of the advances. Now, in the heart transplant now the biggest thing was organ harvesting, because that heart may be available in Utah and it may be needed, may be biocompatible in New York, so it needed to be transported. Okay, and usually the window was relatively narrow because the heart cells again die without adequate blood supply, and even with quick transport and helicopter transport. So now finally a system has been devised which is called the heart in the box, that the heart can be alive, beating with perfusion technology, with organ care system. So that's called the so-called heart in the block by pumping the donor organ with warm oxygenated nutrient-rich blood. And so this can be, just sits inside a cart and can be transported easily. And again, saving the precious time and a loss of the tissue. So it can be transported literally cross country. Okay. And so this is the big new advance that has taken place. Now, what about now there is organ shortage, as you very well know. So the French, they are, ahead of the time, and a French company called Carmet has devised a true artificial heart. The first artificial hearts were done in the United States, but again, they had a problem with clotting and just did not pan out too well. And people had a lot of complications with infections and big tubes sticking out of your heart. But this French heart is, it's a marvel of design. It weighs, roughly 4 kilograms. It has biocompatible material from tissues from cows and valves and inside. So it reduces the need for big blood thinners. Okay. And it has two ideal chambers with two hydraulic pumps, which adjust, what the heart rate in real time and match the blood flow depending upon patient's exertion. So you can just say it's a marvel of engineering design. Okay. Hydraulic fluid pressure maintains membranes, various valves. So it's almost like a soft tissue engineering that is taking place. Okay, and this is not just a bridge to the heart while waiting for transplant. This has been approved as an end all free all type of thing. And so, but unfortunately, as it happens in private enterprise, their financing is falling apart. So some angel investor is trying to get them started again. Okay, so enough about transplant. Now, what about isotope technology? Nuclear cardiology was coming into existence based on varieties of man-made radioactive isotopes that were injected. As I mentioned earlier, they were used for thyroid disease and other cancer earlier in 1940s, with the cyclotron and as a spill from the Manhattan Project and varieties of isotopes, including technetium. Technetium is the technically devised, so it is the first man-made element, atomic weight 43, I think, and that is being used. And this has been the workhorse of nuclear cardiology. It is injected at rest and is perfused inside the myocardial tissue. The half-life is about 6 hours, so it became very perfect. And as you can see, that the varieties of imaging of heart that has been taking place. SPECT means uh, the photon emission computerized tomography, which is done with the so-called Anger camera. The radioactive technetium isotope is injected, okay, and it's perfused in the myocardial tissue. The yellow means it is, it's completely perfused, it's color-coded images. And then patient goes and exercises, and with exercise, if they have blockage, the demand decreases, and you can see that there is a defect. Okay, so there are so this is one way to diagnose heart disease before the heart attack takes place. Okay, so this was, really a big part of my practice. And then varieties of other advances based on sophisticated agents that have taken place, and not just photon uh, uh, imaging with CT scanning. Now, positron has been used as well, but the positron machines are quite expensive and they're used rather sparingly for diagnosis. Okay, and this not only does it characterizes not just atherosclerotic or heart plaque, but amyloid plaque. Amyloid is a degenerative disease that takes place as human beings get older, and varieties of other diseases are also being imaged with the radioactive isotope technology. Okay, so that's this. And some of the technology is limited by the body habitus, especially in women with large breast sizes. So one has to work around it. And with more, and so the two competing technologies to diagnose heart disease is the SPECT means photon emission computer tomography, okay, uh, and positive emission tomography, okay, and they both look similar. You can just see how stress rest perfusion. Okay, and you can see how, with exercises, if there is a defect, at the bottom part, it looks less thin. So this requires various visual training. Now again, this may be, and the AI technology may turn out to be better than physician. Similar to the positive emission tomography, as you can see how it doesn't look like a full donut, but if there is a defect right here, you can see that there could be either a permanent damage or a reversible damage. So that's how one can make a diagnosis of heart disease. Okay, so again, and there are varieties of sophisticated radioactive contrast agents are being used as N13 ammonia or 82 uh, rubidium. So this is one way. Now, just for compare and contrast, the photon emission tomography, again, the energy is relatively small. Well, PET has higher energy, which is, even though it's higher energy, it's for a very quick time, short time. So the exposure, radiation exposure, is relatively small. The half-life is longer, and this can be manufactured locally in a generator. Okay, while this requires a big expensive cyclotron, so the PET scanning is far more expensive. Okay, and now the SPECT images takes longer time. There's more radiation as well. Okay, with time exposure, even though the intensity is lower, it takes a long time to acquire enough data, or count as we call it. Okay, and then last but not the least, computerized scanning, which was started for head, has been uh, evolved. The engineering has evolved enough that you can get, an image within one heartbeat, and this is the image of the heart. Okay, you can see that, it's a much more. This is not affected because it's an X-ray type machine. It's not affected by lung tissue. Okay, so you get a much clearer image than what we could get with ultrasound. At the same time, the heart disease, the arteries can develop calcium, and based on calcium scoring, we can diagnose disease before it causes an event or heart attack. Okay, and now initially the very first ultrasound CAT scan that was done in 1960s in UK. Okay, it took for a small slice of brain, it took 1.5 hours to acquire image. Now it can all be done in 1 minute, in one slice. Okay, now hopefully I'll have a slide that will play. These are some of the modern CT scans. You can see that the image is absolutely stunning image in color, and this is computerized angiography. As you can see, the blood vessels outlined as it would be on. And there are varieties of this alphabet sloop means computerized tomography, coronary angiography, okay, and this is a fractional flow reserve. You can do various sophistication calculations of the flow pattern. Okay, not only that, we can measure the amount of adipose or fat tissue around the arteries. So the science has advanced dramatically even then, since I have retired. So preparing for this talk gave me an opportunity to brush up on my how what I have what was discovered after I quit. Okay, let's just see that hopefully this is an interesting video from University.
This is a picture of the current generation of scanners that we're operating with. There's 3 of these operating in the system here now. You'll see it's a fairly typical looking CT scanner. Here's a patient inside having a cardiac scan done. You notice the tech is kind of blurred in this picture because she's moving quickly. The scan doesn't take very long, and timing is everything with these procedures. Just to give you an idea of what it's like, if I took the cover off the machine, this is what the interior of the machine would look like. And this is how it rotates around the patient. But if I were to do a actual cardiac scan on a patient, just to give you an idea of how quick these scans are and how quick the machine is, the first thing I do is wind the machine up and get it moving fairly quickly. We inject contrast in a vein, in an arm vein for this, so the injection would begin about at this point. And the actual scan itself lasts 5 seconds. It's 1, 2, 3, 4, 5 seconds. The scan's over, and the machine now slows down and winds down and stops. You've just witnessed the full timing of a cardiac CT. Well, why do we want this scanner? Well, this is what the machine can do. This is not a simulation. This is a real patient. We scan this patient, their entire heart, their entire aorta, the chest, the abdomen, and the pelvis in 9 seconds and produce this level of detail of fine arterial anatomy throughout the entire body. I call these eye-popping, eye-candy images, and they're truly impressive. The diagnostic power is amazing. If we concentrate just on the chest, here's the aorta, and also the coronary arteries, you can see as they rotate. This patient we were particularly interested in because they had an anomalous vessel down here, which went into the lung. But you can see the extent of coverage and the detail is produced, and in this particular case, in 6 seconds. Dr. Goldberg talked about carotid disease in the neck. We know that.
Okay, I think that's getting a little too technical. So now, last but not the least, technology is called magnetic resonance imaging. That has to do with your body is 80% water, so it has to do it with the hydrogen molecules that are subjected to huge magnetic field, and then based on radioactivity, the image is turned off, and some very complex math takes place when the molecules assume the original shape, because as with the magnet, they are turned north-south, aligned properly with the magnet, but then they change. And so the image is created based on a complex math that takes place inside the equipment. That's the cardiac anatomy. Let's see if it plays. As you can see, the blood flow that you can see that takes place, it's just a very quick short frame basically. So this shows the heart, the main chamber, aorta. And similarly, this is the cardiac anatomy, and lying in a subcostal position, and this again, takes place. The big advantage of MRI versus CAT scanning is there is no radiation, but at the same time, you cannot have any metal inside, and it's very claustrophobic for patients. So again, this is measured in Tesla. The magnetic unit is measured in unit called Tesla, which is about, I should say, 90,000 more than the Earth's own magnet type of things. It's called 1 Tesla, if I remember correctly. And MRIs have a long history of discovery. Now, this is how the coronary arterography is done. The injecting dye, you can just see this where the arrow points, there is blockage. And then with the balloon, it's advanced and it is removed. So this is, and again, so now there are again further advances taken place with, it's called intravascular ultrasound. That is done with this catheter that you saw earlier for inside the heart. This can be inserted. Even the miniaturization has become amazing, that the catheter can be advanced and take images of the inside wall of the heart, as you can see where the plaque can be measured. And similarly, now this is again, the resolution becomes a problem. So another technology that is devised is called optical coherence tomography, which is, it takes the image due to light waves, which we borrowed the idea from the eye doctor, so to speak. And this gives in, images near infrared light to produce cross-sectional images with, very high resolution of 10 to 20 micrograms. Okay, and it's precise detection of where the plaque is. Okay, and that helps us, but trying to do balloon angioplasties. Okay, so and these are the variety of stents. Again, this is highly involved with metallurgy and complex engineering. Okay, the shape is important. This for the first generations were plain metal valve, and then there are varieties of alloys that are being used, including cobalt and titanium, and then furtherly to prevent narrowing of the heart and arteries, again, because the nature does not always cooperate with engineers and physicians. So that is, these are called drug-coated stents, which prevents the scar tissue that can be a problem and require blood thinning. So it is, so there's a very sophisticated engineering and material science that is involved. So the rapamycin, which prevents the immune reaction, at the site, is also used, in a generic name. It's called sirolimus-coated drug stents. So there's, so the chemist, biochemist, and engineers and metallurgical engineers, all teams have collaborated in reducing the disease process. Okay, and again, so not only that, the scaffolds are made something called biodegradable, that once it stays open and the body forms the endothelial level, then the drug can be dissolved. So there are varieties of alloys are being used which are biodegradable, so and this is Again, they are called something called smart stents. Okay, that is the new things as to with Wi-Fi technology, we can measure the pressure, viscosity, surface change, and can predict as to what is likely to happen. Because a stent thrombosis is a very life-threatening event, because you just have to rush by the seat of your pants and try to fix the problem. Okay, so this is the smart stents have become, and so these are varieties of coatings and are being devised with highly sophisticated engineering processes. Okay, okay, and the ideal stents, and they again it works with various polymer technology, has a huge role to play in terms of keeping the stents open. Okay, this may be a cartoon type diagram. Let's just see. It's like I think you get the idea. I don't think for sake of time. Let's just see. Oh yeah, I think it's worth show and tell. Okay, you can see the blockage here, and right there. Okay. Okay, they're coming in with the dye. Okay, and then they'll put in the coil or the stent as they call it. And it's delivered and it's expanded for a few seconds. And you can see the blockage is slowly dissolving right in front of our eyes. And the coil is holding up the walls. So it's basically a civil engineering process with the help from other sciences is deployed. That's the word that they would use in the laboratories. And again, this is all done through catheters inside the groin. Okay. So it takes about a couple of hours at the most, but it requires avoiding big bypass surgery. That was the state of art before the stents and coils became available. Okay, all right. Now, what about other devices when the heart is failing? This is called the artificial heart pump. And initially, these devices were external with a big pump, like a big refrigerator type machines. But again, they are being miniaturized. And the device that is currently the popular one is called Impala, which is a brand name, by the way. And this is, it goes inside the valve, and the device is inserted through the catheter, and and it's the smallest heart pump, which is minimally invasive surgery, which helps pump the heart from the main chamber of the heart. So the device is right around there, and it pumps across in the aorta, supports organ during when the heart is weak. It makes it life easier, and it allows the heart to recover. So it's called left ventricular assist device. Basically, that's what the word that is used. And after the healing process, the device can be removed again. But at the same time, it has a risk of bleeding, infections, and blood vessel damage, irregular heartbeat. Okay, and so this has been around for a few years now, and it has made a dramatic difference in terms of weak heart or the damage after the fact, so to speak. And patients can generally walk around with this thing, so some of these are some of the earlier devices that they can walk around like carrying their fanny pack, so to speak. Okay, and now sometimes the genetic technology is relatively limited, but there is still some role for
US scientists fix disease genes in human embryos for first time. For the first time, scientists working in a US lab have used gene editing to correct a disease-causing mutation in viable human embryos, according to scientific paper published Wednesday. The work, reported in Nature, could be a step toward genetically modified babies. But the altered embryos created in the study were quickly destroyed and never intended to be implanted in a woman, a step that would be illegal under current regulations in the United States and many other countries. Still,
Okay, so but unfortunately, monogenic diseases, genes related to only one disease, are relatively uncommon. And the hypertrophic cardiomyopathy I've mentioned to you last time, that has to do with the muscle being more thick and causing obstruction to the flow of the heart on the left side. So And there is another disease also where the blood vessels are too thick, called Marfan syndrome, which are you're extremely tall and your tissues are very fragile. And that again has to do with the genetic abnormality inside the muscle protein. But the diseases which are more frequent are, polygenic. So that's where we are still chasing our tails, so to speak. And now we didn't talk much about the blood vessels. We talked a little bit about blood pressure, but the bioengineered blood vessels have been devised because again, so and those have been used with the donor muscle cells and polymer technology and a Dacron graft. This has been actually approved by, so this grows along with the patient. So bioengineered starts from tissue donors, and they're cultured inside bioreactors, okay, and tube-shaped polymer degrades as the cells form the shape, okay, and then so this is the strong tube-shaped tissue is formed basically, and this will give its benefit and avoid rejection problems. So this is the bioengineered blood vessel. So that is, so we don't need those old Dacron graft, which would not grow with the as the child gets older. And it has the problem of having foreign tissue. Okay. And again, the personalized medicine, again, some gene testing. I mentioned last time the blood thinner called warfarin. And now that the dosage adjustment was very tricky because some people have metabolic inborn error of metabolism with their liver can either burn off the warfarin too quickly or not quick enough. And so that is where the genetic screening is available. Now, at that time, we were not aware of any of this. So we used to give advice as to avoid leafy green vegetables such as broccoli and asparagus, etc. But now this type of testing is not cheap, but it is available and helps improve the uh, risk of bleeding. Okay, and now there are varieties of intracardiac monitoring devices have been around, called implantable device. Okay, let's see. I think I have about 10 more minutes. I should be able to finish in time. I'm sorry, I should have edited this a bit.
Heart failure is the final stage of heart disease. So everyone who has heart disease, which progresses, unfortunately ends up with heart failure. And it is when the heart really can't meet the demands of the body. So patients who have heart failure are easily tired.
This goes back to the
and it is a really common problem. Virtually all of us either have a family member or a friend who has heart failure. These patients are frequently hospitalized. In fact, there are over 1 million hospitalizations for heart failure just in the US.
Oh, yes.
There are over 6 million patients who have heart failure and almost 1 million newly diagnosed cases every year. It is a huge economic.
Yeah, I think it's a little too long to not have things. Sorry, I should have. So this is a little device that is monitored, a paperclip size sensor inside the right side of the arteries with a catheter, and it transmits pressure recordings to the physicians, to say if you're, so it again prevents the hospitalization, is able to predict whether somebody's heading for trouble. Okay, so enough about that. Now, at the same time, we talked about the stimulation of the vagus nerve. This is called the baroreceptor that is implanted inside the carotid artery, and it senses for refractory high blood pressure. And this, again, it's an electrode assembly with a pulse generator. Okay, that's, that's a disc that is put inside the on top of the blood vessel, and it positioned inside the sinus. Now, remember I talked about the pressure on the carotid sinus that slows down the heart rate. So this has been known to be beneficial, but again, the use is only for people who are not responsive to conventional therapy. Okay. Heart regeneration is very elusive because heart cells, once they're set, they don't like to change too much. Varieties of gene-based therapies, vascular endothelial growth factor or SERT protein, which is inside the sarcolemma, is being considered. Okay, and there are varieties of delivery methods are being elaborated, but still the result is for studying the heart muscle. The cardiac organoids are being used. There are four and five types of cells inside the heart. Okay, and which is the cardiac myocytes, endothelial cells, and fibroblasts, So these are constructed with various biomedical technology and 3D printing, and there are varieties of uses for disease model, drug evaluation, transplant, etc. So, okay, and this again talks about there are challenges because what can be done inside lab is hard to scale up because you need billions of cells and not just millions, type thing. So, and these are different organs have different tissue properties. The heart is more good sensation, liver has different types of cells, so does your kidney. Okay, and resolution length is different for all this tissue. Okay, and at the same time, not only that, it needs perfusion called vascularization. As you can see how intensely vascularized the heart muscle is, and so here is kidney and liver. Okay, so that is 3D imprinting of different layering of a gooey type of tissue is quite difficult and a challenge, but people are doing some highly sophisticated experiments at Stanford. So this was one of the lectures for those of you who want to know more about it. Okay, and then again, there are varieties of patches that are big. Remember, I talked about the surgery to change the shape of the heart from basketball to football. So then there are varieties of cardiac patches are being devised to put in where there is damaged. And this was a paper from a Chinese research group called Tang, or triboelectric nanogenerator, which converts the mechanical energy of the heartbeat into usable electric. Okay, and it causes the potential difference between two areas of tissue. Okay, and that drives the circuit. So you can just see as to how complex but clever device is to using heart's own beat to convert energy, and that's why it was called the triboelectric nanogenerator. Okay, and that offers where sensors type of art. But this is again, very preliminary work at this stage. But the idea is just phenomenal as to how the sensors and other places are playing a role. But that may be down the line. Okay, and there are the varieties of films that are being placed with thin graphene material, and again, varieties of polyvinyl material. Okay, and that's and okay, and putting a patch inside the heart muscle that is damaged, and it again changes the expression of various cells related to the metabolism of the heart. Okay, and again, now this was interesting that there was enthusiasm for scar tissue. So now one of the researchers out of UC of San Diego has avoided all the stem cell problem by creating what is called myocardial matrix hydrogel. They have denatured the heart cells and have created like a literally powder that can be injected inside this with the catheter. So it's a non-living product basically. So a graft, so you can use it off the catheter, and it's like the heart is denatured using simple detergent type of thing. Okay, and they've created a chemical called Ventrigel. Okay, and it has a good safety records, 3-year safety records, and patches have been placed inside the heart. So it's like fixing a broken heart that can be useful for people with damaged heart or babies which have a less efficient heart. Okay, so this may be something much more viable to avoid the expense of stem cells. Okay, and last but not the least, xenotransplantation is still being experienced by George Church, who I mentioned earlier. He has a huge lab at Harvard, Mass General, and various private companies. They devise, special pigs which are free of virus. They're bred from basically one donor, one break, and they've eliminated with CRISPR technology varieties of heart and created heart. Okay, now this heart has not been used, but the kidneys that company has generated has been transplanted into humans and has avoided the rejection, because otherwise there are glycoproteins that lead to rejection. Okay, so that has been a big problem. But Dr. George Church is well-financed laboratory, and he's a giant in his field, as I mentioned earlier. And hopefully time will tell as to how. And he's a local Florida man. And this is homework for you. You can solve these math equations. We just had Valentine's Day, so you can solve this. Okay, but I don't think I'm going to see you guys. So the answer is LOVE. Okay, hopefully this was fun for all of you. And I think I had 1.5 hours, so I will stop my share and wish you all the best on your careers.